Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this particular section, I'm going to be talking to you about the relationship between exercise and heart. The commonest question a person asks is, how does exercise help the heart? Well, you have to be in good shape, or at least in reasonable shape, to exercise. So make sure you get a good clearance from your doctor first before you resort to any form of exercise. That's one thing I always recommend. So having said that, say a 30, 40-year-old individual wants to exercise, lose weight. What should be the maximum heart rate? What should be the duration? These are common questions people ask. Well, first of all, let's understand what kind of exercises are available. So broadly speaking, very basic, aerobic exercises are like cardio fitness. So they all increase the cardio endurance and the fitness as well. And the types of exercises which are included within the aerobic category are treadmill walking, running outside, swimming, playing tennis, soccer, cycling, very popular, stair mastering in the gym, hiking and trekking is very popular in the summer months, and specifically so there are mountains around where the person lives. So these are nice aerobic exercises, but you have to be fit enough to really participate into this, and you can increase your cardio fitness based on that even further. Anaerobic exercises are the ones where normally done at a gym, and they increase muscle tone and mass. So weight training and lifting are very commonly sought after anaerobic exercises, where the person wants to build a lot of muscle mass. For instance, your biceps, your quadriceps, your triceps, your trapezoids, your shoulder muscles. If somebody wants to develop those, anaerobic exercise will increase weight training, which have to be graded again. You just can't go and lift 50 pounds right away, but start with 10, 12, 15, and go on and so forth, and keep doing it 3 to 5 times a week for 30 to 45 minutes a day, and one can achieve a great deal of muscle tone and mass increment. The third category is calisthenic exercises, and here these exercises really utilize the body weight of the person itself. So in other words, whatever your body weight which is existing, you are utilizing that against gravity, and you're trying to bend, you jump, you skip, and do some rhythmic stretching, etc. Squats, sit-ups, pull-ups. These are great exercises, by the way, and they don't require any equipment, so that's the best part. So having said that, there are 3 kinds of exercises: aerobic, anaerobic, and calisthenic, and you can mix them up and get a good muscle tone, get a good cardio endurance, and of course calisthenics give you everything, remember, and they don't require any equipment, so that's the best part. And you'll see a lot of that, when you go out to the park, you'll see a lot of people doing tai chi, jumping, skipping, rhythmic exercises, or doing the bench push-ups, etc., etc. Now let's understand what should be your heart rate when you're exercising, and what are you trying to achieve? Well, there are 2 things that you're trying to achieve. 1, you're trying to achieve a cardio fitness, and 2, you're trying to either maintain your weight or lose weight. Those are the 2 major reasons why somebody goes to the gym or somebody exercises. 1, to improve your cardio fitness, and 2, to maintain weight or lose weight. Now, how do you calculate what your heart rate should be? Well, the heart rate is calculated by a very simple equation, and that is the magic number 220. Remember, 220 minus your age. So say, for instance, your age is 30. Okay, so 220 minus 30 will be 190. Say your age is 40. So 220 minus 40 will be 180. So that is your maximum predicted heart rate. One should never ever increase your heart rate beyond that number, of that magic number you just achieved. So say, for all practical purposes of this discussion, we'll just include 30 as the magic number. So 220 minus 30, which is your age, which gives you 190 as your maximum predicted heart rate. It's called MPHR, maximum predicted heart rate. So a 60 to 70% of that maximum predicted heart rate will help you achieve weight loss if you exercise for 45 minutes to an hour. Now remember, each pulse is your heartbeat, and each heartbeat, and the heartbeats in 60 seconds will give you the heart rate. Okay, so as long as we know what heart rate is, it's your pulse per minute. So once we know that, then we can we know what should be your maximum pulse during the time when you're exercising. Assuming that you're exercising for at least 45 minutes to 60 minutes or an hour, if you achieve 60 to 70% of your maximum predicted heart rate, you will either maintain weight or there will be some weight loss. Now, if you increased your level of heart rate from 70 to 80% and keep the maximum predicted heart rate of 70 to 80% for 45 minutes to an hour, you will start achieving cardio benefits and weight loss as well. However, if you went over 85% of maximum predicted heart rate, then you're really getting into the top cardio fitness. In other words, now you're training for a marathon or a swimming event or a cycling event, etc., etc. So just remember, these are the three categories, and these are the three types of exercises. And I hope you learned a lot from this. Basically, now you know how to calculate your maximum predicted heart rate, which is based on your age. As I said, if you're 30-year-old, it's 220 minus 30, and that'll give you 190. Okay, and anything like 60 to 70% will give you weight loss, and 70 to 80% will give you cardio benefits and weight loss, and 85% will give you a top-notch cardio fitness. But that's only for really real individuals who are planning to run marathons or races or certain events they want to participate. Okay. Well, stay tuned, and I'll have more interesting stuff coming down the line. All right. Now let's hit the gym and keep your heart rate going. Goodbye.